Hello again, friends. This is Christian for Life Force Microscopy. I'm presenting to you the PolySAN blood test for detecting inherited miasms. So here we have the different PolySAN's remedies. So what I basically did was to mix one blood sample, that is one single drop of blood on each of these circles, and then I added in sequence one drop of the PolySAN remedy. So here we have PolySAN A, PolySAN D, PolySAN DX, PolySAN E, and PolySAN G, the first 5 on this side here. Then I added PolySAN K, M, OM, R, and T for a total of 10 remedies. So what is going on here? Well, as you can see, if a specific PolySAN remedy reacts with your own blood, it will create an agglutination reaction. So let's see what's happening here. We have a reaction right here on PolySAN A, and you see a slight agglutination here. PolySAN D is negative. PolySAN DX is also negative, no reaction. On PolySAN E, we have a positive reaction. There is a agglutination. On PolySAN G, there is nothing going on there either. PolySAN K, there is agglutination there. PolySAN M, there is a little bit of agglutination. PolySAN OM, there is nothing there. PolySAN R, there is agglutination. And PolySAN T, there is nothing. So we have a positive reaction for PolySAN A, PolySAN E, a little bit on PolySAN G, PolySAN K, M, and R. So we have 1, 2, 3, 4, 5, 6. We have 6 positive reactions out of 10, which is basically normal. Sometimes is 1 or 2, sometimes it is 4, 5, or 6. So now that we have the test results finished, we can draw conclusions as to which PolySANs have reacted and its possible meanings or consequences.